Welcome to Local Edition on Time Warner Cable. I'm Steve Swatt with the Sacramento Report. In the next few minutes, we're going to talk about substantial changes, hopefully, according to our guest, in the efforts that we make to provide services for developmentally disabled Californians. My guest is Jeff Stone, a member of the State Senate from Riverside County. Thanks for being with us.
Thank you.
So I guess we should talk about the system we have in place right now. You have 21 regional centers.
Correct.
that help the developmentally disabled, but you
Yes.
also have some larger centers.
Yes. Yes, some of the more historical hospitals up in Sonoma and down in Costa Mesa, Fairview Hospital.
Right.
And over the past few years with the economic crisis that we've had in California, we have not funded those 21 regional centers appropriately. So the demand for services, especially with the higher incidence of autism now, is being perpetrated on these regional centers. And the funding, of course, is de minimis. So we're finding ourselves in a way, turning away people that need those services. And so we've been looking through government efficiencies to see if we can look at the more antiquated hospitals such as Sonoma and Fairview and Costa Mesa and see if we can find some money to help augment the services for the developmentally disabled. And we've learned through the legislative analyst report that Fairview in Costa Mesa and Sonoma treat about 1,000 patients at a cost to the taxpayers of $500 million. So that's $500,000 a patient that we're spending in really old, antiquated, take your developmentally disabled patients and family and lock them away. You know, that's not to say that the families aren't empathetic and going to visit with them, but it's just not a cost-effective model when in the community we have 279,000 developmentally disabled people that are in the community where they thrive better at an average cost of $17,000 per day. So can you imagine with the savings what we could do to, number one, give them the 21 regional centers the funding they need to take care of these disadvantaged people, right, and eliminate waste in our.
So you want to close these two larger facilities,
yes,
and take that money to boost funding for the regional facilities.
Exactly. So we're not only going to save the money on the operations, which is very expensive, but also in Sonoma you've got some expensive land. In Costa Mesa you've got some expensive land that can be returned to the tax rolls for private sector to use. And the money that's generated from the sale of those properties, again, can go right back into aiding those with developmental disabilities, which I think is very important.
There have been a lot of stories recently of abuse and neglect in some of these larger facilities.
Yes, there's been 13 deaths over the past roughly 14 years. And 6 of them occurred in the Sonoma facility, and there's been incidents of using tasers on patients and sexual abuse, and in fact, federal funding to the tune of $100 million has been in jeopardy for paying for services in developmental centers because of these abuses that have been articulated.
This does bring to mind a situation in California in the late 60s when state hospitals were closed, and the idea was to get the patients in the community.
Right.
But the problem was the local community agencies were totally overwhelmed, and that effort was widely blamed for a huge rise in homelessness. So you can't close these facilities, right, without boosting efforts in the regions.
Right. Well, they closed those hospitals without any infrastructure, but more importantly, there was not a dedicated funding stream that appropriately would take care of these people in the community. So you need to have a transition plan. You can't just go in and just close these facilities tomorrow and wheelchair these developmentally disabled people out of these facilities and expect them to get appropriate care immediately. This is something that's going to have to be done with a carefully thought out plan. The goal is to give the developmentally disadvantaged the services and the care they need. And I think those that have been in these hospitals for 20, 30 years will do better in the community setting at a much lesser cost.
All right. Senator Stone, thank you very much for coming by and talking about this important issue. We'll watch the progress of your legislation in the next several months.
Thank you very much.
And thanks to our viewers also for watching Local Edition on Time Warner Cable. A reminder, you can see this and other interviews on YouTube, also on My Government On Demand. Have a great day.